This presentation was created by Karen McClure, Service Manager for East Kilbride Locality, and Jacqueline Fox, Professional Lead Nurse. The presentation will provide information on a pilot and test of change carried out in a community setting and involves the administration of IV antibiotics at home. The methodology utilised to analyse this test of change was based on a PDSA method. East Kilbride Locality introduced a test of change from September 2017 to June 2018. This pilot, created for service improvement, involved the administration of intravenous antibiotics in the community setting as an alternative to hospital admission or prolonged length of stay as an inpatient. A short life working group was formed and consisted of community nursing disciplines from the East Kilbride ICST and acute disciplines from local University Hospital Here Myers. Together the group developed a test of change. Initially this involved the patient group with a diagnosis of cellulitis who required 48 hours treatment of IV flucloxacillin, 1 gram 4 times daily, via bolus administrations. This would be administered at home. Methodology. A Plan, Do, Study, Act PDSA methodology was utilised testing and analysing the data. This analysis of key indicators provided care assurance within the pilot. The Short Life Working Group met regularly to share patient and staff experiences, discussing areas for improvement. The patient's GP was advised of the prescribed IV therapy. However, the consultant physician remained the clinical lead throughout the patient's IV treatments. ICST East Kilbride Straven had an existing core group of 15 nurses previously trained and skilled in IV medication administration. The remaining 22 registered nurses within ICST required IV training, which involved completion of a LearnPro module and attending a face-to-face practical education session. Staff then had to complete competencies in bolus administration, continuous and intermittent infusions over a 3-month period. To support the test of change, the IV training was delivered by NHSL Practice Development Team in Monklands Hospital. The practical competencies required by the community nurses were supported by OPAT, Outpatient Antibiotic Therapies in Monklands Hospital, and the assessment unit in the local hospital Here Myers. Trainings were coordinated and supervised by the professional lead nurse. Initially, only the East Kilbride locality was included in the test of change, but it was agreed by the Short Life Working Group to include the Straven area due to an individual patient's circumstances. Duty rostering had to take into account the availability of nurses skilled in IV medication administration for all shifts, day shifts, back shifts and night shifts, to ensure medications, which may be prescribed 4 times daily, could be safely administered. Within the East Kilbride locality, there are now a total of 40 registered nursing staff skilled in IV medication administration. Currently within the teams, there are 3 registered nurses awaiting training. Training costs were established at being approximately £230 per member of staff. Training times and relieving staff members to attend acute wards to achieve competencies. To date, a total of 34 patients have been treated in the community, one of which has had 7 episodes of treatment. IV therapy treatment at home for 34 patients incurred 2,298 Band 5 community nurse hours and a considerable number of Band 7 hours incurred by the professional lead leading this service improvement. There has been a total of 650 bed days saved by admission avoidance and earlier discharge. The patient who received 7 courses of IV antibiotics, meropenem twice daily, previously spent 9 months in a 12-month period as an inpatient. She required IV therapy for a treatment of recurring sepsis of unknown origin. At present, she continues to be well and managing to be at home. Treatments have progressed with IV antibiotics such as meropenem, daptomycin and ceftriaxone. Varying conditions of infection are referred to the team and considered other than cellulitis. As well as bolus administrations, IV therapies are also administered by intermittent infusions where necessary. There is strict governance and gatekeeping in place. All patient referrals are reviewed by the OPAT team consisting of infectious disease consultants, microbiologists, microbiology pharmacists, and nurse specialists. Patients attend the OPAT clinic on a regular basis where infection status, antibiotic efficacy, and general health are reviewed. OPAT and ICST are in regular contact discussing the patient's plan of treatment. PDSA cycles instigated the following. All referrals are now assessed by OPAT before acceptance by ICST. Infection prevention and control measures are supported by the inclusion of PVC bundles in patient records. Cannulation training is now included in the later cohorts of the IV trainings. The purchase of portable telescopic, lightweight IV stands for continuous infusions. A review of shift patterns supported later administrations of IV therapies. Back shift hours were amended to support the pilot test of change. Where are we now? Existing skilled staff can support peers with IV administration competencies. The community team, ICST, now have adequate numbers of skilled staff to consider referrals for 2 or more patients at any one time for IV therapies at home. Midlines for IV access are now being considered for use and trainings being organised. In turn, this will prevent usage of central venous access devices, which are more invasive. Plans to support other localities within NHSL with a future rollout. Evaluation form. The evaluation form captured clinical outcome. Was there any improvement in the infection, readmission, or no change? Programme outcome. Was the treatment completed as planned or reason for non-completion? Were oral antibiotics commenced? Was there any vascular access complications? Was there any adverse drug reactions, including associated diarrhea? Patient experience and feedback captured? And the time spent on community nurse visits. Patient feedback was all very positive. This slide captures patient statements. All patients were delighted at being able to receive IV therapy at home and avoid admission to hospital. The following video clip is based on Janice, a patient who spent 9 months out of 12 in hospital as required IV meropenem to prevent recurrence of a sepsis of unknown origin.
People in some areas of Lanarkshire, including the East Kilbride locality, are able to receive IV antibiotic therapy at home.
Hi, I'm Jacqueline Fox. I'm professional lead nurse at East Kilbride Straven. I've been the lead practitioner regarding the IV therapies.
A key aim of the pilot scheme is to reduce hospital admission, the length of time spent in hospital, whilst crucially ensuring patient safety. So what is IV therapy?
IV therapy is where a patient has to have a medication administered intravenously, and this hasn't been done before in the community. So if a patient has to have any IV antibiotics administered, this is generally done in the acute setting. The patient can be clinically well, but they have to stay in hospital because they're getting IV therapy. So within our pilot, we want to get patients out of hospital. We want to bring them home where we can administer the IV medication. Today I'm here to see Mrs. Wilson, Janice Wilson. She has to have IV antibiotics to treat this, and she's had a long stay in hospital. So the consultant actually approached the community team to see if we could care for Mrs. Wilson at home.
For 9 months of the last year, Janice Wilson was in hospital as an inpatient undergoing IV treatment for sepsis. Jacqueline meets with nurse Marie Gilroy, who's providing the hospital level care to Janice in her own living room. Specially trained staff like Marie have been equipped with enhanced clinical skills to carry out the procedure at home.
Morning. How are you, Janice?
I'm doing all right, thank you.
That's good, you're looking really well.
Thank you.
Okay, so we're just doing Janice's IV antibiotics today and also ensuring that her PICC line is free of infection and patent as well. So that's a weekly procedure.
That's good. And
Marie's expertise and special training ensure patient safety. IV therapy at home also costs a lot less than keeping someone in hospital for the same treatment. But for patients like Janice, the benefits are priceless.
Oh yeah.
Hello
How are we
Richard,
doing?
how are you? Yeah,
Oh,
we're
I'm doing fine.
Good, good.
Everything all right in here?
Yeah, we've
Yeah.
just finished doing Janice's
Yeah.
procedure and the antibiotics.
As I say, it's great that the girls can come in when I'm at home and they can give you this. And I know I don't need to go in the hospital because I was in there for so long. It was really.
it was a long time,
It was a
Janice,
long
wasn't it?
And I was going up twice a day.
And he was going up
You
twice.
was
That
up
was
twice a day,
the
so
choice.
that in
And
itself.
up at night as well.
That's right.
wasn't it?
Yeah,
Yeah.
basically.
I felt I was kind of wasting a bed being in there
Right, okay.
because I felt, because I get the
Felt well.
antibiotics, I felt well. So, and when you come in and said that you could do it at home, I thought, oh yes.
I know.
Right.
It was just marvellous.
Bye, Mrs. Wilson. So that's us just completed administration of an IV antibiotic with Janice, and as you can see, she's
It's
absolutely
successful.
delighted with the service that we're providing, and it's keeping her at home.